Welcome to this month's segment of Community Connections. My name is Michelle Ray Meredith, and I will be today's moderator. We welcome with great pleasure, Justin Rinehart. Justin is a community engagement manager with DispatchHealth who facilitates partnerships with home health agencies, senior living communities, and physicians across the greater Denver area. His clinical background began at the Medical Center of the Rockies, where he practiced care as an emergency medical technician. During this time, he has attained his master's in toxicology from the Colorado State University, further honing his clinical background and understanding. He's taken his knowledge and passion for innovative healthcare and applied it to DispatchHealth to better serve the community and to change the way healthcare is delivered. Have you ever been so sick you knew you needed urgent care, but did not want to wait in an urgent care facility or pay emergency room prices? Well, Justin is going to share with us a wonderful resource that will not only save a trip, but save your pocketbook too. Justin is asked to have an interactive presentation, so please do not hesitate to ask your questions. And without further ado, Justin, the web is yours.
Fantastic, thank you. Well, I hope everyone is doing well today, and hopefully I can answer anybody's questions if they come up. So DispatchHealth, really the idea behind DispatchHealth is we are a mobile urgent care. That means we can come into your home and we can treat you right in your home. Now, this idea was actually founded by Dr. Mark Prather. He's a board certified ER physician, and what he did is he kind of looked at this here. If you look at any freestanding emergency room, you're going to notice one thing, and that's keyly that 60% of that patient population does not need to be seen in the emergency room. They can benefit from other forms of care. One of those forms of care being DispatchHealth. So what we ended up doing, which is pretty nifty in my opinion, is we integrated ourselves into the 911 system and partnered with South Metro Fire. So what would happen is this. If 911 is called and it was deemed non-emergent by the dispatcher, DispatchHealth will go out to these calls and we would treat these patients on scene along with Denver Metro Fire. Now, what was cool about this is we actually learned two things from it. One, we had 0 adverse outcomes. So that means it's safe and appropriate for us to treat patients in their homes. We treated over 400 patients, and the second thing we learned from that is we saved these individuals over $1 million in healthcare related costs. Last year alone, I believe we saw over 10,000 patients, and that cost savings was over 20 million, I believe. There is a huge cost savings to utilizing DispatchHealth over going to the emergency room. Now, as we exist today, you can call us. Our number is 303-500-1518. And now you'd be connected with one of our clinical support staff. Really, it's their job to clinically assess you, make sure it's safe and appropriate for us to come out and treat you. And if we deem it safe, we're going to go ahead and we're going to dispatch one of our teams. Our teams are comprised of a few individuals here. You're either going to have a nurse practitioner come out or a physician's assistant come out. Everyone is going to be accompanied by an EMT, and everything is overseen by an emergency room physician that's sitting in our office going over your electronic health record in real time. Now, what's kind of cool about this is everyone is family practice. So we can treat across the lifespan. We can do 3 months of age all the way up to our oldest patient to date, which I believe is still 107 years old. So we really can treat everybody. And that's the idea behind this. And to really drive that home, I have a story that I like to share about one of the patients I got to treat when I was on the clinical team. Now, it was this little 5-year-old girl. She's 5 years old, and we're coming to her house, and she had this little finger laceration, and I'm pretty sure it needed stitches. So we come in, we knock on the door, and her mom answers the door. And I see this little girl down the hallway, and she just starts shaking her head. She is not excited about this at all, right? So we we go in there, and then I get down on one knee, and I start talking to her. And what she had done is she had ran off, grabbed her favorite blanket, and just threw it over her head, right? So she wouldn't look at us, but she's just sitting there sticking her little finger out, won't look at us to save her life, right? So we're just sitting there doing that. And I'm like, okay, this is going to be a hard one. So I'm like, hey, I think we need to do stitches. more vigorous head shaking, she's not having it. So it's kind of interesting. We had literally just gotten coloring books in our kits about a week before, and I offered her a coloring book. Now she had kind of a light at the end of the tunnel from this. So what she did is she's like, okay, a coloring book. So I'm like, so can we do stitches if you get a coloring book? And I get a single head nod. So I think we're in now. So I go ahead, I pick her up, and I take her over to her kitchen sink. I get her finger rinsed out and everything. And then we get her situated on her mom's lap at her dining room table. And we get everything all numbed up. She doesn't really try to pull away. She doesn't cry a whole lot. But you imagine the second that we were done stitching her up, that blanket came flying off, right? She just threw it off. And then she immediately finds me and she's like kind of voice kind of quivering now. She's like, I would like my coloring book now. And I'm like, honey, I would give you just about anything right now. It was like the sweetest thing. And the reason I like to share this story with all of you is I want you to think about it. I want you to take a moment, maybe put yourself in her shoes or even in your own shoes if you've been to the emergency room. What is the emergency room experience like? It's a fantastic place to be if you're having a medical emergency, if you're having a heart attack, if you're having a stroke, if you're having any other life-threatening illness, you want to be in the emergency room. But if you're not having one of those, then you can benefit from other forms of care in your home. And that's the key play here, is we can come and do that. You're going to be most comfortable in your home. And when you're really feeling sick, where do you want to be? Do you want to be out and about? Now, if we kind of go ahead and we can take that, how is all of this paid for? That's a key question for everybody. How does this get paid for? Well, I can tell you here in Denver, we are partnered up with every single insurance company here in the Denver metro area. So Humana, Aetna, Cigna, Bright, Anthem, Blue Cross, Blue Shield, Kaiser, Medicare, Medicaid, TRICARE for Life. We really are on board with every single insurance company. And typically how we look with these insurance companies is we are an urgent care visit. That means you would pay your urgent care copay, not an ER copay, not a specialist copay, but your urgent care copay. Now, if you have Medicare, typically speaking, it's very, very cost effective to utilize us. I believe the average cost is about $5 if you just have straight Medicare. If you have any sort of supplemental insurance, it expands. I think a lot of times you'll be left with $0 out of pocket as they're going to go ahead and they're going to pick that up. Now, as far as our clinical capabilities are concerned, we have a pretty wide array of clinical capabilities. So we are a CLIA certified lab. So what that means for all of you is that we can do point of care testing. So strep, mono, influenza, RSV, we can treat all of that right in the home. We can come in, we can do a quick swab, a quick test, see if you have one of these infectious diseases and start treating it immediately, which makes a lot of sense there.
Justin, we
Yes.
have a few questions for you.
Perfect.
We have Barbara Sullivan that's asking a question. If we can unmute her, that'd be great.
Mm-hmm.
Devin? Barbara, are you there? Well, let me ask another question while we figure that out.
Sounds great.
The question is what does the cost on average in a home cost other than the co-payments?
So if you were to look at the cost, really it comes down to your insurance because everything is at an individual rate. And even if you're with the same insurance company, your plan might be different from somebody else's plan with the same insurance company. Typically speaking, the average cost is about $275, and that's what's charged to your insurance company. So it depends on if you have a PPO plan, then you're just responsible for your copay. Then it's typically $35 to $75 is a typical urgent care copay. If you have a high deductible plan, you're looking at about $275.
Excellent. And then you mentioned about electronic health records. Are
Yes.
you able to tap into someone's primary care physician's record on the client?
We can do that with a few select PCPs that we have partnered with here. We are looking to broaden that. But we also, if you guys have all heard of Choreo, and if you haven't, what Choreo is it's what all the, so everyone uploads all the information to the cloud, right? And that's kind of how the idea is behind it. Well, this has a lot of your hospital visits on there. So if you've been to the emergency room and it's been pushed to this, we can go ahead and we can look you up while we're on our drive and coming to your house and start developing, a care plan based on your past medical history that we can look up. And then we can, what your, current symptoms are. And we can start creating like a medical game plan for when you arrive. We already are able to start directing care in the right direction is the idea behind that.
Great. Well, we have Barbara unmuted at this point. So Barbara,
Perfect.
if you can hear us, you're on.
Hi, Barbara.
Oh, I can hear you, but I don't think you can hear me.
I think I can hear you now. You sound good.
Well, when I raised my hand, it was just to let you know that all the sound left.
Oh, okay. Well, I'm glad that you're able to hear us now, Barbara. Thank you.
This is all really cool. Thank you.
You're welcome. Well, Justin, we have another question for you, and it's from Crystal. And Crystal says, are you guys based only in the Denver area, and are you looking to expand?
So we started here in Denver. We're a home company here to Denver, Colorado. We've kind of expanded our just areas here that we can see locally in Colorado. So we have an office in Colorado Springs as well, and our catchment area for that. So we can go from Colorado Springs all the way up to Longmont currently, Golden kind of being the other cutoff there, and then maybe DIA is the other cutoff. Now that's here locally, so it's a really, really broad area that we're able to come into here currently. Now, what we can actually do as far as the rest of the community, we are in Phoenix, we are in Las Vegas, we are in Richmond, Virginia, we are in Texas, we are in Oklahoma, and I believe we have plans to open up a new office here in the next couple of weeks. So we're excited and we're expanding very, very rapidly.
Justin, does that mean that if I'm traveling in Vegas and I need help, I can just call you to my hotel room?
Yeah, definitely. We're happy to come to your hotel room and treat you. I've done that a few times myself, where we treat individuals in their hotel. I mean, it's fantastic. I mean, you're somewhere where you don't have your PCP available. You don't want to drive to an urgent care because are you going to take a bus? Are you going to get a taxi? Are you going to get an Uber? How does that work? Well, we can come right to your hotel room, which makes it pretty fantastic.
Excellent.
All right, any more questions for me? I like questions.
Not at this time.
There we go. All right, so I'll get back into what we can do clinically then, and we'll just kind of go from there. So I was just kind of saying we are CLIA certified. We can do all those point of care tests that really help drive care in the right direction. On top of that, we also have what's called an iStat. So an iStat's a nifty little machine. It's about maybe that big. Oh, there we go, that way. It's about that big. And what's really cool about it is you can take a drop of blood, and with a drop of blood within 3 minutes, we can do a basic metabolic panel right in your home. So basic metabolic panel, we can assess your kidney function, your electrolyte levels, your blood levels, get a good idea of what's going on internally with you. And that gives us a good idea of where we need to take treatment to put it in the right direction to get you feeling better. Now, we also carry with a small pharmacy. On this pharmacy, we have antiemetics, we have anti-nausea meds, steroids, antibiotics, both IV and oral. And the idea with having this small pharmacy with us is this: we're able to give first dose medication. So let's say we come in and you need antibiotics. We're going to go ahead and give you enough antibiotics to get you through that day. That way you don't have to rush out to go get your prescription. We've already started care. We've already given you what you need. That way you can rest and relax that first day, start feeling better, make arrangements either to go get the medication yourself or have somebody else pick it up is the idea behind that. The next kit I like to go over is our lac wound kit. Lac wound kit, it's pretty straightforward for the most part. I like to say that we can sew, staple, and glue, kind of the arts and crafts of the medical world, if you will. So we can come in, we can do sutures, we can do staples. If it's a skin tear, we can go ahead and glue it as well. We have everything we need to irrigate and clean the wound to help prevent any infection that might take place. We can even do certain bites, whether it's animal, we can come in and do those as well. So it's pretty interesting what we can do, that we're able to do stitches right there in somebody's home, which typically speaking, people would go to an urgent care. They go to an ER for something like this. We can take care of it right where you are at, is the idea, which makes it
Can
pretty
you
neat.
explain,
Go ahead.
Justin, can you share an example of what you may not be able to help in the home?
So the biggest things that we can't help in the home, I mean, if you start thinking life-threatening, so heart attack, stroke, those are things we cannot treat in the home. That's something where you need to be in the emergency room and you need a full team of physicians working around to figure out how to treat you and how to help you. We're there for that interim that's in between your primary care physician and the emergency room. So we can come out for acute infections, we can come out for stitches, we can come out for minor breaks, IV fluids, you're not feeling well. We can come out for a multitude of things, but once you cross that gap and you start getting into where it becomes possibly life-threatening, that's where our threshold ends. Because there's a time frame on this, which is actually, this is a good little segue here for that for a second. We are about an hour and a half to 2 hours out, given on time of day. Our average wait time right now, I believe, for us to make it out to somebody's doorstep is about an hour and 15 minutes. So if you can wait an hour and 15 minutes for us to come out and treat you, then we're a fantastic option. If you can't wait that long, then you need to consider other alternatives, one of them still being the emergency room. We're there if you can wait for that and it makes sense to do so. Did that answer the question well, you feel like?
Sure did. Justin, what about, we work with a lot here at People Care Health Services, we do work with Medicaid clients, and sometimes they do fall. Would you be able to help with fall assist?
So we cannot, so that goes back kind of the other, we cannot do a fall assist. We cannot do a lift assist, if you will. So if they come out and they fall, back to it, we're still about an hour and a half out. We can't leave them on the ground that long waiting for us to come out. It doesn't make sense for us to do that. If they're able to get back up and they don't want to go to the emergency room, we can come out and do an evaluation after they've already been lifted, if that makes sense.
Sure. Thank
Perfect.
you.
Not a problem at all. Any other questions?
Not at, we do have Barbara that has another question, I do believe.
There we go.
Barbara, can you hear us?
How does this compare with having to go to the doctor's office? Is this just strictly after hours? What is this?
So the idea is it's a mobile urgent care. So the idea is it's not strictly after hours. It's for if you can't get into your primary care physician. So really we can do anything that's kind of rather acute is the idea. We're not looking to replace your primary care physician. Your primary care physician is supposed to see you from, point A to point B, whatever that is for you. We're there on those humps where you can't get into their office. It's after hours, it's weekends, you can't make a same day appointment. That's where we make sense to utilize.
How does the cost compare?
How does the price compare? So with your insurance, it depends on what insurance you have, but typically speaking, there's a difference in cost. So your PCP is always going to be your best option price-wise. That's always going to be your best option. So if you can get in to see your primary care physician, that's what I would recommend you do because they're the one that's going to know the most about you. Now, if it's something that kind of exceeds their specialty, so we can do a higher range of things that they can do just in their PCP office. They're not going to do IV fluids. They're not going to do stitches typically. That's where we come in. If it exceeds their capacity to treat you, we can come in and do it, if that makes any sense. Price-wise, PCP is going to cost less than us. We are an urgent care copay. And that's typically, if you look at your insurance, it depends. Typically, it's about $35 more than your PCP copay.
Well, say for instance, like in our area, sometimes you can't get in to see your doctor. They're booked up and they won't let you in.
And that's it. If you can't get in with your doctor and you still feel like you need to get some care, that's where it makes sense to call us. We come out, and what's awesome about us is when we come out and we treat you, every single thing that we do with you is automatically going to be sent to your primary care physician. That way there's no gaps in your care. So they know exactly what we've done with you, how we've treated you, and they can pick up your care from there and hopefully take it in the right direction.
Well, that's cool, but we don't have anybody on the Western Slope like that, like you guys.
No, not a problem at all. Thank you for being here. And Barbara, if you have any more questions, I'd love answering your questions. So thank you.
Okay.
All right. So I can get back to it. Oh, go ahead.
I'm sorry. We do have another
There we
question
go.
from Crystal. Let's hear what she has to say.
Can you guys hear me?
We can,
Perfectly.
Crystal. You're on.
So my other question is do you guys provide like x-rays and ultrasound? Do you do mobile x-ray and ultrasound as well?
So we can. So if a patient's considered homebound, they qualify for a mobile x-ray to come out or mobile ultrasound to come out. So we definitely partner with Pacific Mobile and Shriver, and they're going to be able to come out and we can treat them that way. So
Awesome.
I mean, if a broken bone, they can come out do an x-ray. If we think pneumonia, they can come out do a chest x-ray as well. If we're thinking, you know, they might have a DVT, deep vein thrombosis, they can come out, do an ultrasound, either confirm or deny that diagnosis.
Very cool. And then my other question is, do you guys think you'll ever expand to the Western Slope?
We may expand to the Western Slope. I can't give a definitive answer on that right now. We are having conversations with people that are up there. It would be more of a partnership. We might have somebody that has a physical location up there, and we might give them our utility to operate a DispatchHealth service up there by giving them all the technology to do it. So we may expand. It might look different than how it is here in Denver, though, if that makes any sense.
Okay.
Perfect. Any more questions for me?
Crystal. Not at this time. Thanks.
Perfect. All righty. So I'll go ahead and get back to kind of what I was talking about here. So with that small pharmacy, it really is awesome that you're able to get all those medications. You know, we can do wounds, we can do wound care and things like that. If it requires more wound care than we're able to do, that's where we partner with home health entities, and they can come out and they can do the other wound care that might need to take place. Moving on to our GU kit is another really interesting kit. We can do anything from catheters to G-tube replacement to enemas. Not too much more detail about that, but we really can do a lot with the that sort of kit. One of the biggest things we end up treating just across the board is bladder infections. So if somebody gets a bladder infection, okay, that's bad. But what you need in order to treat that is going to be antibiotics. So we can come out, do a urine dipstick test it. If it comes back with leukocytes or nitrates in the urine, that is usually indicative of a UTI. So what we can do is we can go ahead, give you medication, start treatment, get you feeling better, and we're going to tuck you back in with your PCP is the idea behind that as well. And they're going to know everything we did with you. Our next cool kit that we have is our ear, nose, and throat kit. One of the hallmarks from this one is definitely our ability that we can do a nebulizer treatment. So for a lot of patients, you know, if you have pneumonia, if you have the flu, it's a respiratory disease. That means your oxygen saturation levels can dip. And eventually, if they go low enough, it can become an ER visit. It can become a hospitalization. We're able to come in there and we can do like a neb treatment. So we can do albuterol accompanied by a steroid. And really the idea is that we can really dilate everything, really get your lungs open back up, hopefully help force the fluid off of them with the steroid. That way we can get your oxygen saturation levels back where they need to be. That way you can avoid that ER visit. Another cool thing from the kit we have here is, typically speaking, warfarin, Coumadin, those blood thinners, nosebleed can become pretty bad to the point where you might end up needing to go to the emergency room, and they can cauterize it on, you know, at the ER. We actually work with the technology that's mobile, so we can actually come out and chemically cauterize a nosebleed right in your home using a chemical cauterization, which is, it's pretty nifty. I mean, it really takes something that previously people were going to the ER quite frequently for, and we're able to treat it effectively and efficiently right in someone's home or right in their community is the idea behind that. Now, another kit that we have is going to be our ortho kit. So let's say I were to fall, right? I took a nice little spill and I felt my hand outstretched there, and I might have fractured my wrist, which is bad. That'd be bad. So if I went to the emergency room, this is what they would do for my wrist. They would go ahead, they're going to x-ray it, they're going to splint it, and they're going to send me home. And that, all of that was like a 3 or 4 hour experience if I went to the emergency room to do that, because it all takes time. A minor fracture is not a life-threatening illness, so you're going to be there longer than everybody else. and it's going to delay treatment. Now with us, we're going to do the exact same thing. We're going to come out, we're going to go ahead, we're going to splint it. We're going to have, we can have a mobile x-ray come out if you're considered homebound. X-ray you right in your home, get it splinted up. We're going to help you follow up with your primary care physician or a specialist if you might need surgery. And really everything is taken care of from there. You never left your home, and it was, your wait time was much better than if you went to emergency room. Average wait times for an ER vary between 2 to 3 hours. Once you're in the ER and actually receiving treatment, the average ER visit is even on top of that. It's about 3 to 4 hours as well. So you're looking at a rather long trek if you're going to make it to the emergency room. It's a whole day event where we can come in, do the exact same treatment process in less time and get you moving to where you need to be, whether it's just resting in your bed or back to your day. Let's see, any other kits I can go over for you? I believe that is all my kits. Are there any more questions for me? How this is paid for? What our clinical capabilities are? What we can treat, what we can't treat, anything else like that?
I have a comment for you, Justin.
Perfect.
I would just say how wonderful it is to know when cold and flu season comes about that we can actually stay at home and not share our
right? Don't
germs
share
with someone else.
Yes, keep it at home, keep it away from everybody else. Don't share the flu, don't spread the flu. But that's exactly it. I mean, it's a fantastic thing. I mean, that's actually a good point though. Think about it that way. So you go to the emergency room. How many other diseases you think are living in the hospital? C. diff, MRSA, possibly a patient with flu. You have all these things that you're exposing yourself every time you go to a place where they really clinically sick individuals. You're going to be exposing yourself to these bad microbes, these bad diseases that you really don't need to expose yourself to. And even if you're not, if you have kids, you have sons, you have daughters, and they go in and you get yourself exposed to it and you expose them to it. So there's a whole slew. If you can avoid the ER, my advice is you should always do so. There's just better forms of care out there, and they're going to spend more time with you. Any more questions for me?
We'll give everyone a few minutes to see if there's anything else that we can answer
Okay.
at this time. Justin, you mentioned that you are expanding.
Yeah.
We talked about a little bit about Grand Junction, of course, or the Western Slope.
Yes.
But what about Fort Collins? Did you happen to mention that area yet?
So we do have ideas to expand up north. We're looking for a clinical partner to do that with. So if we're able to nail down a clinical partner, we will be expanding up north is the idea behind that. I don't have any more details on that, but then it would be, I'm excited about it because I'm going to be living up north, and to have more dispatch health, especially to be able to come to my home when I'm living up there will be fantastic. So the idea is eventually we will have an office probably up in the Fort Collins area, and we'll service all the way from Colorado Springs all the way up to the Wyoming border. So we really are going to end up treating a lot of people there.
If you could just share with our listeners today a little bit about that cute little dispatch car that you drive around. That is completely, it's like it's a genius on wheels, right?
Well, I mean, whoever did our marketing and everything really did a good job. It really is a cute little car. And right now we're driving around. So initially, when we first started, everyone was driving around in a Prius. And then snow hit, and it turns out a Prius in a full-blown winter storm wasn't the best idea that we had foreseen. So what we did is we actually ended up buying all the cars here now are going to be Nissan Rogues here in the Denver area, and all of the Priuses are actually in, I believe, Phoenix, Arizona, which makes perfect sense out there. There's no snow out there at all, so I think they're going to be okay with it out there. But
so that's a good question. How are you able to travel through all types of weather, and can we call you at 2 o'clock in the morning?
So our hours of operation, so you can call us at 2 o'clock in the morning. I don't think anyone's going to answer though. We will have an answering service, but the idea is our hours of operation, we start from 8 a.m. and we go till 10 p.m. I don't believe there's any idea of expanding that right now as we currently have it. I think that's, we were able to provide a good treatment. And if you can't get treated in that time frame, and then overnight you start feeling sick and we're not available, then that could be an ER visit for you, is the idea behind that. But we are able to be at your doorstep by 8 a.m. is the idea. So we can start treatment pretty early in the morning, all the way through pretty late at night there.
Excellent.
Perfect, perfect.
Well,
All right.
I just want to remind our listeners that they can reach Dispatch Health at 303-500-1518. That number again is 303-500-1518 for an alternative in savings versus that urgent care or emergency room. We don't have any other questions today.
Perfect. I have some closing remarks that I can go into if that
Excellent.
works. Perfect. So, and let's take a look at this here and then why things are going kind of the way they're going in the healthcare industry. If you look at the healthcare industry as an average, right now, the average patient satisfaction score is a 30%. Why is it so low? Why are we doing something wrong in the medical world here in Colorado, or not even in Colorado, just across the United States? Let's look at it. So if you go to the emergency room, really think about it for a second. How long does that physician spend with you? 10, 15 minutes if you're not having a life-threatening illness. They're going to spend a lot more time with you if it's something life-threatening. Now go to your urgent care. How long does an urgent care physician spend with you? They just don't have that much time. My last urgent care visit, I think, lasted 2 to 3 minutes. I had a sore throat. I came in. He felt my neck. He's like, I think you have a sore throat. I'm like, I agree. I think I have a sore throat. He's like, all right, let's do a quick strep swab. Boom, boom. And it was done in 3 seconds. We spent all of, I think, maybe 2 minutes conversing. And then he's on to the next patient. Even your PCP, my PCP, I love him. He actually does spend quite a bit of time with me. But how long do they get to spend with you? And the idea is this. How many patients do you think that ER room physician has? 10, 15? He has 10 to 15 patients that he has to round on every single hour. You take it to an urgent care. Their idea is they have to cycle people through and get through everybody in their waiting room so that they don't have a long line for it. Even your primary care physician, they have so many patients that they have to get through every single day. They have to get through all of their appointments, so they have a timetable to keep. They're not able to spend that extra time with you. And I think that's why those patient satisfaction scores have gotten so low. Now, here at Dispatch Health, our patient satisfaction score to date is a 96. It's not that we're doing something amazing. We're doing really what always should have been, and that is providers spending time with their patients. When we come out, we spend about an average of 1 hour with every single one of our patients. During that time, question, how many patients do you think we have? One. We have one patient. That patient is you. That is whoever is in front of us, that's who we're treating. We're not worried about our next patient. We're not worried about our previous patient. We're worried about getting you taken care of and moving your care in the right direction. And that's what moves healthcare in the right direction. And that's why our Net Promoter Score is so high. It's because we're doing something different. We're putting providers back in the homes of our patients, which allows them to spend quality time with them, get to know them and their healthcare background so that we can change it for the better. So I hope that nobody ever has to use our service. Know that we are a fantastic service that has been able to help thousands here in Denver and across the United States now. So that's all I have for you guys. Thank you for having me.
Well, thank you too, Justin, for joining us. And we'd like to also thank everyone else for joining us today and participating in the interactive seminar that we had today. Please mark your calendars to join us next month as we explore the importance of advanced directives. Community Connections airs the second Wednesday of the month at 1 p.m. Until then, may your month be everything you want it to be, and bye for now.
Bye, guys.